Hi there. Welcome. Would you mind introducing yourself?
My name is Dr. Lemay, and I work here at Sleep Therapy and Research Center.
And I'm Dr. Sarah Andre, and also work here at Sleep Therapy and Research Center.
So tell us about your site and what type of research you conduct.
Our site is Sleep Therapy and Research Center. This center has been founded in 2006 by Dr. James Andre, and he created this to be a comprehensive facility to serve the community where he was born and raised, and provide exceptional sleep-related care for our community. And we've been guided by his vision and under his directions, following that vision and striving every day to provide that level of care for our sleep patients. We do have 3 locations across San Antonio, which makes it very convenient for our patients for sure. We evaluate and manage patients with various sleep disorders, including narcolepsy, sleep apnea, restless leg syndrome, REM behavior disorder, circadian rhythm disorders like shift work or delayed sleep phase. And we offer our patients the way to diagnose and the way to manage according to the most current guidelines. We offer our patients the in-lab studies and also the home sleep studies. And when it comes to management, of course, sleep apnea for decades, it's been the first-line therapy, CPAP machines. But now, actually, we can talk about oral appliances. We can talk about Inspire implantable device, and we can guide the patients through these therapies as well. We have the Texas School of Sleep Medicine and Technology. And through that school, we're able to teach and train sleep technologists. It's an accredited program through the American Academy of Sleep Medicine. And we value that component of our practice as well, because many times we're able, in a sense, to grow our own sleep technologists. And it helps us as a sleep center for sure. When it comes to research, we have been heavily engaged in research for sleep apnea and narcolepsy. Strong emphasis on narcolepsy, actually. And we've been doing this for 18 plus years. We've been privileged to participate in what I call great research studies, innovative therapies, groundbreaking, definitely, that help make a print in the field of sleep medicine and in the field of treatment of narcolepsy. And it's something that we're very, very proud of, for sure.
What makes your research center unique?
I think Sleep Therapy and Research Center is unique for all the reasons that Dr. Lemay just gave, And I think it's obvious that it's not just research conducted in a vacuum. We're both providers. We both have extensive training in sleep medicine and obesity medicine. Not only that, but we use an interdisciplinary approach to treat our patients, neurology, psychology, pediatrics, even pharmacology. And I think Dr. Lemay alluded to another great point as well, that we just have state-of-the-art facilities, and we're really very much happy to share that resource with our patients and provide excellent patient care.
Why are you interested in narcolepsy and narcolepsy research?
Well, this is a great question. You hear a lot that narcolepsy is a rare disorder, right? And we don't feel that way. We may disagree. It is a complex chronic disorder with a complex presentation, right? So it affects the brain ability to regulate sleep and wake cycles. And it kind of encompasses other symptoms that are very disabling for the patient. Patients present with sleep attacks, excessive daytime sleepiness, nighttime sleep disturbance. They are having memory impairment. They're saying, I feel foggy, I can't focus, I can't get anything done. Patients have hallucinations, and They suffer from sleep-related muscle paralysis, which can be very scary, vivid dreams. And these patients get many times, mistaken for depression or psychosis or ADHD or conversion disorder. So there's usually a lapse, I would say, maybe according to, what's published there, is that lapse of maybe 8 to 10 years between patient presenting with symptoms and somebody figuring it out and saying, yes, this is narcolepsy. So the patient many times suffers, and it does impair the quality of life for sure, and it endangers their life, like safety-wise. Patients who have type 1 narcolepsy, which is the one with the cataplexy, they can have this loss of muscle tone, which can range from slurred speech all the way to that dramatic full-blown cataplectic episodes. And that can cause a lot of safety concerns and disability for these patients. Through research, through narcolepsy research, we're able to provide hope for our patients. Another avenue, especially for those patients who, I would say, have exhausted the options available, pharmacological options available. We do use, of course, behavioral therapy for those patients. We try environmental, control the environment around them, and accommodations at work or school. But those patients still suffer. They suffer dramatically, and they do need something else. They need another avenue. We tend to see the more complex narcolepsy patients just because of our reputation and how long we've been here in San Antonio. We get even patients coming from out of town. Some patients travel 4 or 5 hours to come and see us because their providers just don't know what to do with them. And for those patients, having the narcolepsy research available is definitely very valuable for them.
What kind of experience do you have in narcolepsy research?
Sleep Therapy and Research Center being one of the leading institutions in the field of sleep medicine and in the field of narcolepsy specifically, we have been doing research for 18 years. I know Dr. Angie started doing research before I joined. I joined 15 or 16 years ago, I want to say. So we've been doing this for so long, and we've been participating and privileged to be an integral part in a lot of these kind of groundbreaking research studies when it comes to treatment options. And from thinking back, when it's just kind of wake promoting agents, till now that we're seeing more studies addressing the core problem, the underlying cause of narcolepsy, mentioning, hypocretin deficiency. When this was a dream for us, we always talked about it as providers. Is this gonna be something that we're gonna get to see? Is it possible that we can kind of replace that for the patient and fill that void, which we know for those patients that it can make a huge difference in their symptomatology.
How do you typically reach out to individuals interested in participating in a study?
The way we reach out to potential candidates for our clinical trials, many times it's through our clinical practice. Again, we see a lot of patients, and we treat a large population of patients, whether from San Antonio, and like I just mentioned, some people even come from out of town to seek help here. So we do that. We offer them clinical trials. I see that you are on these medications, and I see that your symptoms are not well controlled. You're not functioning full capacity. You're not living the way you want to live, and you want to be more productive, more alert, more focused. we have better options. We have some more options for you. So this is one way that we do that. Another way is that we aim to reach patients through social media, through platforms, and actually collaboration with colleagues here, and reaching out to other providers to spread the word about the clinical trials that we have offering here for the patients.
What are participants at your site saying about their experience?
It's so interesting what participants say about their experiences here. I'd say they're both immediate and they're both long-term. So in the immediate, I think patients are impressed with the comprehensive care that they're getting, as well as the expertise and then the support that they get throughout the entire study. More in the long term, they're inquiring about other research studies that are going on. They're interested in, the value that they've contributed and want to continue giving to, medical research and specifically sleep-related research with narcolepsy, and want to know more about their own condition as well as be able to shine light on maybe what other people are experiencing as well.
What should a patient expect at your facility when participating in a sleep study?
With Dr. LeMay giving that wonderful introduction about our sleep research center, I think that they can expect to be welcomed by really capable and experienced staff. They're going to get great hands-on, treatment, and, have that personalized touch and care throughout the entire process. And I think all without sleeping in a hospital bed, right? I think that's the most sort of experience that a lot of people don't want to deal with. So
that personal touch, I love that. Yeah, that's true.
What benefits should a patient consider before participating in a clinical trial?
So benefits that patients can consider before participating in a clinical trial, I think include an obvious one is furthering the advancement of sleep medicine research, particularly narcolepsy research. I mean, that's huge. They can also consider the access to new treatments that might not yet be clinically available, which I think is important because this is a lifelong disease, right? We're treating this very long term. And so, it's really important to gain insight and understanding into what works for you as well as what doesn't, I think participating is just beneficial not only for yourself, but also as a whole in providing patient care, from our standpoint, to all of our patients clinically, and then anyone who does want to be involved in the clinical research side.
How would an interested individual learn more about participating in studies at your site?
So interested individuals who want to learn more about participating in research studies at Sleep Therapy and Research Center can visit our website at www.sleeptrc.com. They can also call us, either call our general line 210-614-6000, or they could call Joe Perez, our research coordinator, directly at area code 726-900-1101. And we'll be able to provide, comprehensive information on our ongoing studies, as well as any inclusion-exclusion criteria that they may be interested in hearing about.
Are you aware of any good resources for individuals with narcolepsy to learn more about ongoing research studies or for additional information about their disorder?
Yes. Many patients ask us this question, and there are some resources, and I find the narcolepsyproject.com to be a very comprehensive website for patients to go and seek information about narcolepsy research and resources. I do recommend that for sure.
Is there anything else you would like to add before we close?
Sleep Therapy and Research Center is dedicated to making these meaningful contributions to research. Our goal is to improve patients' outcomes for sure and contribute to the research world with advancing therapies and provide hope for patients that there's light at the end of the tunnel.
Yeah, I think we all know that narcolepsy, it's a complex, chronic neurological condition that has both autoimmune and genetic components to it. And I think that makes it a unique challenge, but also, presents an opportunity for innovation as well. And so our work here aims certainly to deepen the understanding of treatments in general, but contribute to kind of a broader knowledge of sleep disorders as a whole, especially with narcolepsy.
Absolutely. Absolutely.
I think this enhances our patient care.
Yes. And we want to thank you guys very much, so much, for your interest in our work and for helping us spread the word.
Good deal.